This is Portfolio Africa, a show where we present deal makers, creators, and leaders from the private and public sectors that are working to transform Africa for the better. To share highlights from their work, I am Kemi Oshukoya, your host. A healthy population equals a healthy economy. Yet, many governments around the world too often don't invest in their healthcare sector, leaving their population and economy exposed to pandemic consequences. This has been the case in many African countries. However, some countries are now addressing this vital issue, coming up with innovative solutions through public and private partnership to tackle malaria, HIV, cancer, and other non-communicable diseases in Africa. Equatorial Guinea is one of those countries in Africa and from around the world that have put healthcare sector at the heart of its economic. Working in partnership with the private sector, the government is tackling the issue of malaria in the country and building a sustainable healthcare infrastructure and data that will allow it not only to address any future health emergencies, it will also help it to provide quality and affordable health coverage for its population. Their innovative project just won an award at this year's Concordia Summit. I sat down with the Deputy Minister of Health and Social Welfare, His Excellency Mitoha Ayekaba, and Christopher Schwab, President and CEO of Medical Care Development, a US-based company that collaborates on the project. First, here is the P3 award ceremony that took place Tuesday, September 24th at the Concordia Summit in New York City, and then my conversation with the Deputy Minister and the CEO of Medical Care Development.
Public and private sector collaboration, embodied by partnerships like the ones we are celebrating here today, facilitates innovation, impact on scale that can bring economic security, peace, and prosperity to all nations. From embracing market-based solutions in agriculture in order to elevate farmers from the poverty in Southeast Asia and Africa, to enhancing access to reliable, affordable, and effective health care in the Caribbean. This year's finalists are driving the solutions that will create a more secure and stable global ecosystem. By using collaborative models and leveraging the strengths of public, private, and civil society partners, the finalists are ensuring the impact they are having today will continue to be sustainable and scalable for the next generation of leaders and innovators. They highlight the value of trust, transparency, and accountability in facilitating cross-sector partnerships that develop and deliver global solutions to some of our toughest problems. These are truly outstanding examples of best practices for working together across sectors to achieve these goals. Congratulations to all the finalists here today, and thank you for your positive impact you have had around the world. The challenges facing our world are complex and in some cases entrenched. However, these partnerships demonstrate that advances in sustainable development, global health, or women's empowerment are possible when public and private sector actors come together to advance shared goals. The Department of State is proud to partner with Concordia and the great UVA Darden School of Business to present this year's P3 Impact Award to a team who is truly showing leadership and delivering results. Please welcome to the stage this year's P3 Impact Award winner. Let's start the drum roll. Let's get it going. Give me a drum roll. I need a drum roll. And the Impact Award winner is the Bioko Island Elimination Project. Let's give a round of applause. Come on up. On behalf of the State Department, we are giving these great doers of good who are making a huge impact on the world, these transformative leaders, a challenge point from the State Department. Thank you again for your service.
I want to congratulate you on winning the Petrie Award. What was the experience like? Coming up with the idea and the process that you've gone through to create the product that you created.
I think it has been a very enriching experience for us just to go through and reflect on the long history of partnership that we have been able to put together, recognize the incredible achievement, and be able to summarize that and to the organizers of the award. And even that single process was, again, a very collaborative among all the different partners. We all made our contribution to be able to recognize the individual so significant achievements that we all have made during the course of this period of time. And then go through the same process with the organization itself and be part of this unique, award. It has been quite enriching,
Okay.
at least for me. So I don't know, Chris.
And you?
I concur with what the Vice Minister has said. I mean, it's really been an amazing experience. It's just another one of the examples of the kind of extraordinary experiences we've had as a partnership. I mean, our focus on a day-to-day basis is on eliminating malaria from Bioko Island, and that involves hundreds of people working in Equatorial Guinea within the Ministry of Health, within this project, which is part of the National Malaria Control Program, going out on a day-to-day basis, spraying the inside of homes, delivering bed nets, working in the communities to look for larval breeding sites and managing those breeding sites, working in the health facilities to diagnose and treat people who still may have malaria. So it's a major effort on a day-to-day basis. But above all of that and coordinating all of that, of course, is the activities of at the management and policy level that are going on, and it takes a team.
It takes a village.
It takes a village to do it, and we really have that. And I mean, as an outside organization, Medical Care Development, it's an incredible honor to be able to be engaged, working in a partnership that is led by an incredible government in Equatorial Guinea, where there is not only the leadership and commitment at the level of the Ministry of Health, but really importantly at the level of the presidency, and then also at the funding level with the Ministry of Mines and Hydrocarbon, where the minister has been absolutely the biggest champion of this program. And with that kind of commitment comes, which is known very well in the country, right, that the government is fully behind this, comes in fact then collaboration on an intersectoral basis, which the ministry then coordinates, and which then gives the program an opportunity to get in at the community level where change ultimately and the intervention needs to take place. And you don't have that kind of credibility unless you have that kind of commitment. So it's extraordinary.
Okay. This is an ideal public and private partnership. And in Africa, especially at this period, yesterday at the UN, one of the major programs that was launched was the new World Health Organization promoting universal health coverage all around the world, but in particular in Africa. In part of Africa, in DRC right now, they are dealing with Ebola. And is a recurring theme, like every 2 years or every 3 years. Malaria has always been a major issue. So usually health has not been a priority for a lot of policymakers in Africa. What was it that made it a priority for your country?
Well, I think our country is really a vision that the president carried itself, and from the beginning he wanted to make a difference in terms of how to invest the oil revenue. And we had the experience of what had happened with our neighboring countries. So we were one of the poorest countries in the continent. So since we already had that experience, he knew for sure what we shouldn't be doing. So we invested massively on infrastructure. So what it means to have the best roads right now in the continent, we have that. Electricity is not an issue, and we have certainly invested in improving airport, ports, and having the best telecommunication network infrastructure. And we have invested heavily also in hospital infrastructure and human development to certain extent, because when you compare from when we started to where we are today in terms of the rate per capita of doctors, and we have the highest, one of the highest in Africa, and all that in tandem put us in the first country that invests in more in health. However, the vision is not to stop there, because as you know, as you're using the most innovative tool technology-wise, that needs to be accompanied with a shift also in the way that you manage your resources, the way you deliver your care. So it means that also we have to change the way our health system works. And this is where this projects come into play, where by investing in a project like this, we have the best of mind in terms of the academia, in terms of management of projects, that can be absorbed and integrated within the ministry, so that we can start redefining how health system should function and work in developing our countries that are in the process of development, like the ones we have in the African continent. This is where I think that we have a unique opportunity in Equatorial Guinea, because you have the leadership, you have the resources, you have the partners to do that in a way that it makes sense for us. And this is what we are trying to do in Equatorial Guinea.
Hey, could you talk to the PP3 to the power two?
So, which is basically, and that paradigm that we think can be the model of how to deliver care for developing countries in the 21st century, is what we have called the PPP Power 2, which is the evolution between project to program and thereon to become a policy.